Imagine you're 8 months pregnant and 6 police officers show up at your door. They arrest you in front of your children for a crime you didn't commit. But why? Because a computer said it was you. This happened in Detroit. Pregnant women spent hours in jail. Then it happened again and again. 7 times we know of. And nearly every victim was a person of color. Here's the truth nobody wants to admit. AI isn't making new mistakes. It's amplifying ours. When we teach machines using our biased data, our racist system, and our unfair decisions, they learn to be racist, unfair, and biased, only faster and at massive scale. According to Yale School of Medicine research, AI algorithms in healthcare are systematically discriminating against people of color. Deloitte warns that biased data sets are leading to disparities in healthcare, unequal insurance decisions. The machines aren't broken, we are. And we gave them our prejudices as their instruction manual. Right now, health insurance companies are using AI to deny your medical treatments. California just passed a landmark law prohibiting this. But it took effect January 2025 because AI was literally making life or death decisions without human doctors involved. In 2023, researchers discovered Optum's algorithm was racially biased. The system was supposed to identify sick patients needing extra care. Instead, it systematically denied patients of color access to the same level of healthcare as white patients even when they were equally sick. According to University of Chicago research, this happened because the AI learned from historical healthcare spending data. And guess what? America spends less on black patients' healthcare. Deloitte's healthcare AI leader warns when a dataset used to train an AI system lacks diversity, that can result in misdiagnosis, disparities in healthcare, and unequal insurance decisions. The AI performs well for certain demographic groups while failing others, literally creating a two-tier healthcare system based on race. FDA data shows 882 enabled medical devices have been approved, predominantly in radiology alone. But Nature research reveals these systems have biases and blind spots could impede healthcare for patients of color. Lower quality performance, wrong diagnosis, denied treatments, all automated at scale. Robert Williams was arrested outside his home in front of his wife and young daughters. The charge was stealing watches from a Shinola store in Detroit. The evidence was a blurry surveillance photo run through facial recognition software. And the problem was, it wasn't him after all. According to ACLU research, there have been at least 7 wrongful arrests due to facial recognition, and 6 of 7 victims were people of color. Federal testing in 2019 showed Asian and black people were up to 100 times more likely to be misidentified than white men. Washington Post investigations found hundreds of arrests based on facial recognition, with police rarely disclosing the use. Here's the scary part. Even when software says investigative lead only, not enough for arrest, police ignore these warnings. University College London research found this automation bias, humans blindly trusting computer decisions, overrides training and common sense. In August 2024, police arrested Robert Dillon for attempting to lure a child. The AI was wrong here as well. When questioned, the arresting officer literally said he was not aware of what to tell, as it was not in his investigation, and he blamed it on a different state. The agencies passed blame while an innocent man sat in jail. The Innocent Project reports that 60% of DNA exonerations between 1989 and 2020 involved people of color, half due to faulty forensic methods. And now we are adding AI bias to the toxic mix already. A Johns Hopkins researcher tried warning healthcare professionals about AI bias in early 2010s, and they shrugged it off, saying it's different in healthcare as they are trying to people here. Then the Optum scandal proved them right. IBM's 2024 report revealed 42% of AI adopters prioritized performance and speed over fairness, knowingly deploying biased systems. Think about that. Nearly half of the companies know their AI discriminates and then deploy it anyway. AI learns to discriminate without mentioning race. It uses your zip code, credit score, even and how your household members' data looks. like invisible proxies that reveal protected characteristics and allow discrimination through the back door. Rutgers research shows AI algorithms perpetuate bias by learning from historical injustice embedded in datasets. We fed the machines centuries of discrimination, then acted surprised when they discriminated faster and better than we ever could. The legislative wave. California's SB 1120 requires human physicians to make all medical necessary decisions. AI cannot deny care alone. New York is demanding algorithm certification. Colorado enacted the first comprehensive AI discrimination law. The regulatory flood is coming. Organizations with bias testing programs were 23% less likely to report financial losses. According to PwC analysis, AI could contribute $15.7 trillion in global economy by 2030, but bias could block billions from being equitably shared. Biden's 2023 executive order demands tools to ensure systems are safe, secure, and trustworthy. The Agency for Healthcare Research and Quality convened expert panels. The EEOC is investigating algorithmic hiring discrimination. Here's the governance framework. Yale researchers identified core principles: representative data, bias testing throughout development cycle, human oversight of high-stakes decisions, and regular audits. More than 20 cities have banned police facial recognition entirely, from Boston to San Francisco. Here's the uncomfortable truth. AI bias isn't a technical glitch. It's a mirror showing us exactly who we are, and we don't like what we see. Every biased algorithm is an automated version of human discrimination, running at machine speed, touching millions of lives. Demand transparency from companies using AI to make decisions about it. Support legislations requiring biased audits and human oversight. When applying for insurance, loans, or jobs, ask if AI is involved and demand explanation of decisions. The choice is we can either fix our human biases before we encode them in machines, or we can create an automated discrimination system that locks inequality in place forever. The machines are learning. The question is, what are we teaching them?